So today we will look at ethics in science, especially when we make decisions in scientific research and other related matters. We all have to make decisions. And many of the decisions that scientists make in the lab or in the field on a day-to-day basis are more or less pragmatic ones. Scientists have to make observations, and in the method of doing so, they will have to use tried and tested procedures or innovate new ones. The decisions are made determined by professional judgment, published previous recommendations, and in consultations. In most cases, these decisions have minimal moral impact. However, there are a lot of things that scientists would have to make decisions on or to make choices about, especially in mentoring and research ethics. Whom to accept as students as your research students? How much credit will you give them for the research that they have done? Especially in publishing the papers, the authorship. Who gets the first billing in the list of authors of a scientific paper, and who gets to peer review? In doing biomedical experiments, we have to make decisions, ethical decisions on how humans will be subjects of biomedical experiments, or even how animals will be subjects of biomedical experiments, and whether these biomedical experiments are really necessary. We have to manage competing interests, especially when it comes to the funding of scientific research. Who do we get funding from? And also in research collaboration, who's going to collaborate with our research? What about intellectual property? Who gets to own the intellectual property of scientific research that results in technological innovations, such as in genetic technologies? Is it really morally acceptable to tinker with the genome of a species, or even to resurrect extinct species by de-extinction, by recreating their genome and trying to resurrect them again? And also, what about scientific integrity? About scientists, whether is it really acceptable for them to a little bit fudge their data, or doctor their data just to get a nice outcome, both career-wise and even in the so-called science? These involve a lot of moral dimensions. Our decisions as scientists or any other, even as an individual, always have a moral dimension. Scientists always been asked to do moral judgments on the methods and protocols they use in their research. For example, the use of animals in biomedical research. While some people regard this as completely unacceptable, a majority of people consider it necessary because of the risk to humans is unacceptably high. And by risk, this means that the risk of harm is high. It is accepted by a lot of people that to do experiments on human subjects, even if they give consent, and if the risk is just too high to their well-being, this is morally unacceptable. And so perhaps you can choose an animal model to do your experiments on. When we do these kinds of decisions, we are entering the realm of moral judgment, in which we consider and reflect on what we ought to do, and that we ought to do is assumed to be the right thing to do. Ethics is often defined as the study of moral values, but we have to ask, what do we mean by moral values? Ethics is about the systematic analysis of our values in seeking a decision on how to act. But morals emanate from our inner convictions and provide the basis and substrate that our conscience uses to distinguish right from wrong. Ethics is the study of the moral values, systematic study of these moral values. And the morals are really part of us, from our inner convictions, and the moral substrate in which we base our decisions on, especially in distinguishing right from wrong. Now, a lot of people would discourse ethics in the framework of religion. And that's not really surprising because a lot of people adhere to a religious tradition or conviction. But ethics is applied universally and is based on logic and reason, not on religious belief. Although some religious beliefs would have an ethical system, but in the case of ethics in science, we're actually looking at a more secular view of ethics. Religion is not applied universally and is based on tradition or injunction. An example of injunction is the one found in the Ten Commandments. Thou shalt not. Okay? Thou shalt not steal. Thou shalt not kill. Those are examples of injunctions. While religions have moral codes, these are transmitted by moralizing stories or traditions. For example, the Sermon on the Mount is actually the statement of Christian ethics for a lot of Christians. But the Sermon on the Mount, as you see here in the painting, is setting a moral code, but Jesus Christ is actually moralizing on it. That's the framework by which ethics may be transmitted by a religious tradition. However, we have our own moral substrates. It could be a religious tradition. It could be your family's beliefs, the beliefs of a particular social class in which you belong to, the national community, and if you're part of a university, the academic community's values, and of course, civil society, which most of us are part of. You would see the picture here, a lot of students standing at attention and putting their hands on their left breast while singing the Philippine national anthem. In the Philippines, it is morally repugnant to disrespect the national flag. If you post a picture on social media showing that you don't stand up for the national anthem, it's almost guaranteed that a lot of Filipinos will bash you on social media. Because that's part of the moral substrate of Filipinos. Whereas in other countries, it might be a non-issue or it might be acceptable not to stand for the national anthem. Although some people will be offended, but the general consensus of society in these countries would just say it's just part of your freedom of political speech. But in our country, it is not really morally accepted. That's part of our so-called civil religious moral substrate. And so to consider these moral substrates and how to make our decisions on whether something is right or wrong, we have to use some ethical frameworks, which could be normative, in which we establish which behavior is right or wrong and set norms for our behavior. For example, standing at attention for the singing of the national anthem, okay? That's a norm, and it establishes a moral theory. Examples of these moral theories include virtue ethics, deontology, and utilitarianism. And also, there is also a part of framework called meta-ethics in which we are concerned with the analysis of fundamental moral concepts. For example, what really is morality? What is the standard of morality? Is it same for all cultures or not? In science, we use two ethical theories most of the time. First is the teleological, which is actually based on outcomes and consequences. And the most famous of these frameworks or theories is utilitarianism. The other is the ontological, or what we call duty-based. And the most famous of that is Immanuel Kant's categorical imperative. We'll come to this in a little while. Let's look at the teleological or outcomes-based or consequence-based ethical frameworks, which was famously proposed by the English philosopher Jeremy Bentham, and this is called utilitarianism. So let's look at the case. Supposing you find a person who has a genetic mutation that allows his cells to produce a protein that blocks the entry of SARS-CoV-2 virus in a patient's cells. This patient or this person does not give consent for you to give a blood sample so you can sequence his genome, take a snippet of the gene locus in the DNA that codes for the protein for you to sequence, and using CRISPR technology, develop a preventive therapy for COVID-19, which will make vaccines unnecessary. If you take this purely on a utilitarian framework, it might allow you to kill this person and get his blood cells so you can give them to the research lab. When that person obviously will die, many people will not die from COVID-19 because they were able to get the gene from this person, which would allow to come up with a treatment that will make vaccines unnecessary. Now, in the teleological sense, you may find this is a little bit morally, what we call morally unacceptable or even morally repugnant. But in the teleological sense, we just want the outcome, okay? In this case, for the greater good of a lot of people. Now, of course, this is quite an extreme way to put it, but what about in another case, which is more probably closer to a lot of scientists' experiences, okay? Another example is if you doctor your data so you can pass your thesis and get away with it, and supposing you do, then you may win the best thesis award in your college or even graduate summa cum laude. You may even have the thesis published and other scientists will refer to it. They would use your data to help them design experiments. Now, if you are a person who follows a utilitarian framework, you would think twice before doctoring data, because scientists will be misled and they might result in an outcome that's negative since they would pursue research without the acceptable outcome, okay? Because it's really based on fake data or doctored data. And the credibility of science with the public will be damaged. And if your data has medical relevance and application, it may lead to a lot of deaths of patients. And it is even more likely that you will get caught and lose your degree. And of course, your summa cum laude will disappear. And very likely, your professional career will be at an end and you will never be trusted again. If you add up all the consequences, which are almost all the time negative, and according to the utilitarian framework, doctoring data is definitely immoral and you should not even think of doing it. So in the utilitarian view or framework, you have to think of the consequences. And if the consequences are negative, then it's immoral. In the other case that we said, you kill the person just to get the cells, the consequences are quite positive. Okay? So is this really a morally acceptable way to go to make a decision? Now, Immanuel Kant, the German philosopher, has a different take on it. It's called categorical imperative, in which he says, act only on that maxim through which you can, at the same time, will that it become a universal law. You want your decision to apply universally. So this is what we call the universality formulation of the categorical imperative. Another formulation of that is what we call the humanity formulation. Act in such a way that you always treat humanity, whether your own person or in the person of any other, never simply as a means, but always at the same time as an end. Now, this deontology or duty-based ethics is called an extreme one, in which the consequences of an act are not to be considered at all in establishing its morality. That's because Kant believed that the utility of an act to determine its morality is a mistake. Such a moral standard compels a person to perform an act in one situation while forbidding it in another. This changing standard was unacceptable to Kant, as utility changes from one situation to another. For example, these examples we discussed about getting the blood cells and sequencing the gene of a person who did not give consent, and the one that in which you doctor data for your thesis, and this could be used for medical research. The utility changes from one situation to another, and for Kant, this is not really acceptable. So let's look at the case. Okay, but before we do that, okay, let me just emphasize that in the humanity formulation of the categorical imperative, this formulation makes it clear that the categorical imperative requires a certain respect for persons. Kant does not say that we never use a person as a means to an end, but just not to use a person solely as a means. So let's take a look at a case, very common to all of us who have seen a doctor. Is it right for a doctor to charge you a professional fee? Okay, a doctor charges professional fees when he or she sees you as a patient. Obviously, the doctor has to make a living. The doctor is clearly using your health status as a way for monetary gain, and you're a sick person. Okay, you're not really in the, okay, a sick person, obviously you see the doctor, and the fact that the patient is sick is going to be used for monetary gain. But it is acceptable that a doctor has to have a way to earn a living and pay for the utilities of his or her clinic, the consumables used for a medical procedure, and the salaries of assisting medical staff, including the nurses. But if your doctor is in the business of just earning money by charging you high professional fees for any medical procedures, especially for a basic one, then the doctor is acting immorally, because the doctor is, in this case, is actually just using you as a means to an end, regardless of what happens to you. Now, in medical practice, doctors usually consider patients are really persons, and they are treated both as an end and a means. The patients have interest independent of the doctor, and the doctor would have to know this, and they have sought treatment. So in the sense, the patients are their own ends, because the doctor wants the patient to recover. Not just to earn money, but the patient has to recover. So, for example, for COVID-19, a doctor who prescribes ivermectin and knowingly knows it doesn't treat the disease is acting immorally, since he or she fails to treat the patient as an end. Because you just want to get the money even if the treatment doesn't work. And this is exactly what quack doctors do. Now, of course, we cannot have this standard universal for doctors. Because if doctors are not considering their patients both as a means or an end, and the end is actually to make sure that the patient recovers as much as possible, as much as the doctor's skill can provide and expertise can provide. And if doctors just care about earning money, then we would lose our trust for doctors. And we don't like that as a universal rule. So a doctor, we can say it's morally acceptable for a doctor to charge you a professional fee as long as your interests are also considered by the doctor. So as a patient, your interest is to get well, and the doctor will consider this as part of the end. And so all of these frameworks, we need to consider the ethical orientations. Now, for example, our ethical orientation for decision-making, moral judgments may be absolutist, in which moral rules apply everywhere, regardless of culture or person or whatever. Or it could be situational, in which the end justify the means, depending on the situation. Kant was not really a fan of this approach. No, the categorical imperative, in which if we really, because we want things to be universal, the orientation really is personal restraint for the good of society. For example, for the doctor, okay, the doctor should restrain from just considering the professional fee in treating patients. Or it could be communitarian, which is for the greater good of the community, or it could be duty-based, which is an inflexible set of beliefs about right and wrong. Now, this is a deontological approach also, and it could be absolutist. So for instance, if you join the military, there are ethics in the military and they're duty-based because you are actually obliged to follow orders. And of course, following orders also is a moral judgment. However, we don't have time to discuss this, but this is important in considering the moral judgment of soldiers in wartime. Dialogue means the respect and views of opinions of many people, and there could be no completely right view or a completely wrong view, which is related to the so-called golden mean or moderation. Instead of taking extreme positions, you take the middle position in moderation. And the famous golden rule, do unto others what you want others to do unto you, which is almost universal because a lot of cultures have a similar formulation of the golden rule. Whatever the ethical orientation you and I would take, we need to use moral reasoning, which involves moral sensitivity. The individual is faced with a situation that makes interpretations considering what actions are possible and who will be affected and how these actions will be regarded by those affected. Moral reasoning, the individual makes a judgment about what action is morally right and thus prescribe an action regarding what ought to be done. So we use moral reasoning with appropriate moral sensitivity because we are considering how it will affect other people. And we also have to make a moral commitment. The individual makes a decision to do what is morally right and gives priority to moral values above any other personal values. And we need to have moral perseverance, which means that we are consistent in our moral positions. The individual implements the moral course of action decided upon, facing up and to overcoming all obstacles. Now, we come to the case of Dr. Ludwik Fleck, who developed a typhus vaccine in a Nazi death camp. Now, perhaps you would recall that the Polish doctor, Ludwik Fleck, set the theoretical basis for STS in his ideas about how society creates scientific fact. Communities create their own scientific fact because they perceive it as such, no? However, one side of the story is also famous, the story of the life of Dr. Fleck. And that is when the Nazis invaded Poland in 1939, they rounded up all the Jews. And because Dr. Fleck was a Jew, okay, he was eventually imprisoned. But we know the story of the Jews in the Holocaust, a very tragic story, which gives us a lot of moral subjects for moral reflection. And in this case, because Dr. Fleck was also already known to be a top-notch medical scientist on vaccines and immunology, the Nazis didn't kill him, but sent him to Buchenwald in Auschwitz and ordered him to develop a typhus vaccine for the SS. The Nazis wanted to keep him alive because he can make the vaccine. However, what he did was to develop a fake vaccine for the SS, and the real vaccine he administered to the Jewish prisoners. Typhus was killing everyone in a death camp, the Jewish prisoners and also the Nazis. Of course, the Nazis were expecting that they'll be given the vaccine. So even if you do experiments on the Jewish prisoners, then the Nazis will be the one who benefits. But Fleck did not really do that. He developed a fake vaccine for the SS and real vaccine for the Jewish prisoners. So making a lot of the Jewish prisoners eventually survived the death camp when it was liberated at the end of World War II. So the question is, did they violate ethical norms for doctors by having a fake vaccine for the SS? So you will watch a video on this very important case in medical and research ethics, in biomedical ethics, in a very tragic time in human history. Fleck was in a death camp. And in the death camp, they were not considered humans. The prisoners, the Jews, were not considered humans. They were considered subhumans at best, and at worst, vermin to be exterminated. That's how the Nazis viewed them. But Fleck tried to hold on to a certain standard of humanity. The question is, was this ethical? So that will be the case that we're going to discuss in STS. Now, in your UVLE classroom, I think I put some videos also that may interest you on ethical positions. These were produced by the US Public Broadcast System, or PBS. It's a sort of crash course in ethics and philosophy for people like us. And this may give you a better or even a wider context to consider the case of Dr. Fleck, because this would also involve the problem of good and evil, the problem of duty or deontology, and the categorical imperative. Okay. What is this humanity standard that should be universal to all of us? And so with that, we can now move on to look at Dr. Fleck's case. That's the only case you can take in STS at the moment, because research ethics and ethics in science, if we really are interested in it, probably should be a one-semester course. But of course, in STS, we're just looking at it as a sort of introduction, some serious questions that we have to think. And because this is part of science in daily life, because we have to make decisions in the use of technologies or acceptance of novel treatments and or novel medical applications, or even in biodiversity conservation, there are moral judgments that we have to do. For example, if you're going to put up a protected area, should you kick out all of the people living in that area just to protect us, to protect certain species? That's a moral judgment. And so this is really part of science in daily life. So with that, we can now move on to the case, and later on we can talk about the case and what your reflections and moral judgments on the case of Dr. Ludwik Fleck, who made the typhus vaccine and gave a fake vaccine to the SS, but the real ones to the prisoners in the concentration camp. So with that, thank you, and good day.